All right, hello everybody. I'm Brian. This is AAMI News and Conversation. We're here at day one, the first full day of AAMI Exchange in New Orleans, 2025. You guys have been having a good time so far?
So far,
Absolutely,
yeah,
yep.
absolutely.
So for the guests who don't know, I'm here today with Ralph Basile. You probably recognize him of the AAMI Foundation, and William Leiva, who we did speak to at Kilmer. Link in the description for that video if you haven't seen it already. But what was really cool about that video is we got some comments, we got some feedback, and people were very interested in the research that you were talking about last time. So we wanted to dig into it a little bit more, answer the questions that were left unsaid after that first conversation. So Ralph, I know you have a list, what people have been thinking about. And before we do that, though, very quickly, Dr. Leiva, the research that we're talking about today, can you give me the elevator pitch?
Elevator pitch.
Yeah,
It's always
elevator
a
pitch.
difficult one. Our sterile barrier system affected by conditions that we're not expecting, or you shouldn't be expecting. That's the research question, right? So, are we maintaining sterility down the road or not? That's a key question.
Okay. And this is about superheated steam that we're talking about, right? What is superheated steam?
It's hot air. It's very hot, very dry air. And what happened is that we call it superheated steam because it happens or may happen within the vessel, inside the vessel. But because it's dry, it doesn't carry the moisture that we need to transfer energy and enable sterilization of medical devices.
Okay, so if I was in a sterility reprocessing professional, I don't actually want superheated steam. I want
don't.
whatever the established steam temperature should be. If it gets superheated, it doesn't work as well?
Not as good, and the research point towards that potential damage to sterile barrier systems. So it's not only that it won't necessarily deliver the sterility that we're expecting, but also we did see some impact on the sterile barrier system. So it would affect the sterility down the road in the storage and eventually jeopardizing patient safety as well.
Okay. This sounds very important. And Ralph, I know this research was funded in part by the AAMI Foundation.
That's right.
What was the grant for that one?
It was the Kilmer Grant, right? And which funds up to $10,000 for a study. And I would say a lot of researchers maybe also draw on other sources of funds if they need to for their study. But I would say it's kind of seed money, if you would, and it can fund the Kilmer Fund can fund studies that maybe would have a hard time finding funding elsewhere. So, and also fund, as you mentioned last time, we'll also fund, a lot of times it's academics, which is great, and certainly the foundation funds studies by academics, but we also will fund studies by independent researchers who oftentimes will have a hard time finding funding from other sources. So,
Okay.
Yeah.
And we have a whole video about that as well. So I should say also link in the description. You guys can find out how you can also get funded like Dr. Leiva's team.
Right.
But you were left with this. I know this research caught your attention. Dr. Leiva, you've been funded by the AAMI Foundation twice now.
Yep.
So we know your team is up to good work. But what caught your attention about this, and what questions are really burning?
Well, actually, professionally, our company has been involved in distributing pouches, sterilization packaging for over 30 years.
Which company is this? We should say
Healthmark.
Healthmark.
And very familiar with the effects of superheated steam. There are other factors too. There's a lot of things that go wrong, that can go wrong in sterilization that can cause issues. But we've seen that, and in fact, so this morning, Dr. Leiva presented here at the exchange, and so I had a chance to sit in bright and early, and so I really heard some things that we didn't talk about when we were in detail when we were at the Kilmer, because you're still working on your research and working on your paper and that kind of thing. So maybe you could talk a little bit about, you observe things that clued you into doing this research. Maybe you could share that.
Yeah, absolutely. So about 10, 12 years ago, I started to work heavily on sterile processing, supporting customers of my previous employer back then in different countries, in different markets, different realities and whatnot. And I started to quickly observe that the pouches, particularly pill pouches, the sterile barrier system, look a bit toasted, a bit brittle after the sterilization process, and I started to wonder why, right? So that was the kind of the beginning of the research question and all that. Down the road, I learned what could be causing that and the different, impact that may have, and connected with some other researchers that expanded on the superheated steam and enable the baseline knowledge that we have today to better understand what the potential impact of this may have on the sterile barrier system. So that's how everything started many years ago. But this is something, and I mentioned that during the presentation earlier, and I believe I mentioned that to many colleagues in the past as well. That's one of the things I like the most about this Kilmer grant, is because we can, of course, try to pursue really challenging science, if you will, but I do think that we need a lot of experimental data based on experiences like the one I started to experience many, many years ago, right? So we try to address challenges that we face today in hospital settings, both in the US and globally, based on the experience we have. And I think that's how I started the thought about this idea. And then the PhD research started to unfold and whatnot, and I needed to pursue more research as well. But that's how everything started. So what if there's something wrong with that particular sterilizer, or with many sterilization cycles for that matter?
Yeah, so one of the things I heard that you touched on is a big driver of ending up with superheated steam is actually the incident of wet pack. And maybe you can talk a little bit about why we get wet pack in sterile barrier systems in the hospital setting.
So how much time do we have? Yeah, we can talk for days, but primarily I think there's two main reasons, right? So the materials and the sterile barriers, that's on the hospital side, that's what they decide. And by materials, I mean the different instruments, surgical devices that they need to sterilize on a daily basis. The combination of materials play a key role there, whether it's going to be metal alloys or different polymers and the design features, whether they're going to be cannulated, they're going to be long and narrow lumens and whatnot. That plays a really, really significant role on the wet packs. This way? Okay, we got that. So that's one thing. The other one, and it might be a little bit controversial because I'm part of the industry and I've been part of industry for many years, right? But the way we develop instruction for use is also challenging for sterile processing departments, right? Because we have general information based on what the FDA in the US requires from the IFU perspective.
But every sterile processing department is different, right? That's the challenge there.
That's one of the challenges, right? But also, we try to standardize cycles where it's very difficult to standardize cycles.
Sure.
So we want to have cycles at a certain temperature and exposure time, and that works for most cases, not for all of the cases. And then back to the wet packs, when you have the combinations of the cycle parameters that we're abide by from the regulations or the guidance that the FDA provides here in the US, and the diversity of materials, the diversity of a sterile load, sterile barrier systems, and the ability or the strategy that the technicians have to load multiple packs in the sterilization cart, that also plays a role in the prevalence of wet packs, right? So it's a multi-factors thing. There's so many things we need to address, but I think gaining a better understanding of the cycle parameters and how we, from industry, from the standard community, standard development community, from the sterile processing department, can look into those factors, we can certainly improve and reduce the number of wet packs, right? Which in turn will require less tweaking of the cycle parameters that may have a negative impact, such as superheated steam.
Mm-hmm. Yeah, I appreciate that. And in fact, the fact of the matter is, as more materials that are non-absorbing or polymaterials have now are finding their way into the design of instruments, which often is hugely advantageous to the instrument itself. Conversely, means that you're more likely to get wet pack, right? And so I was going to say too, the other thing is Dr. Smith wants this in the pack and Dr. Jones wants the other in the pack, and so there's the lack of consistency you were talking about. Yeah, okay. Yeah. So so something else that you were then describing how superheated steam occurs, and so I. Pressurizing the actual jacket of the sterilizer. And the other thing that maybe you can talk a little bit about that and why that happens, And then the other thing I heard you say is that when you get to a hospital sterilizer, the output, the printed output that the sterilizer is showing is not actually measuring the actual temperature in the chamber. And I bet users don't know that. I didn't know that. So yeah.
We have the standards, right, for steam vessels larger than 60 liters or about 2 cubic feet and whatnot, and they describe where the measuring devices are going to be located and whatnot. So we do have that reference, and of course manufacturers follow that thoroughly. There's an AAMI standard as well that support that, and it provides some guidance on the sensors. But when we have superheated steam, we cannot measure superheated steam because the standard for steam sterilizer doesn't require to have a separate measuring device so we can address or we can assess the actual temperature in the vessel. So that's one of the challenges that we have. It's similar to the conundrum of the pressure, right? So we look at the pressure, the results of the printout. It tells you the pressure within the vessel. If you have non-condensable gases, if you have residual air, the pressure may still be within the parameters that the system is supposed to be working at. Nevertheless, you still have residual air, or you may still have non-condensable gases, CO2 and whatnot, impacting the ability of that particular load to be sterile.
Is that because those are residual gases that are a different density? So
it's just because of I forgot the name, I apologize. The law of gases measure the combined pressure of all the individual components of that gas. So if you have air, if you have CO2, if you have nitrogen or whatever other non-condensable gas, meaning that you cannot turn that gas into water or in a liquefied phase, you still have the same pressure. So the pressure is not sensitive only to saturated steam, which is what we really care about. Right, so those are the challenges that we see in terms of vessels. It's not like one vessel is better than the other. They're all compliant with the required standards and whatnot, right? So it's not the problem. The problem is that we do tend to generate solutions to problems, not necessarily considering what the impact might be.
Mm-hmm. Yeah. So maybe you can talk about the test methods that you employed to evaluate then the integrity ultimately of the sterile barrier system, the pouch.
Yeah, and of course, when we do research, we have standardized methods and whatnot. So first, it was the validation of the test method itself. So the control and the experimental conditions of the samples, how many degrees of superheated steam they were going to be exposed to, exposure time, temperature, and whatnot. So that's one portion of it. But the second question is, okay, so once we expose samples to superheated steam, how do we demonstrate whether those experimental samples are compliant with or are maintaining sterility down the road, right? And that's where we look into standards, right? And there's good standards that we use today, ASTM standards, widely used in the industry by all the largest manufacturers, by the largest companies as well, that produce single-use devices, but also the test lab that help us to test products like this. And those standards, again, are very commonly used, broadly used, and accepted in the industry, but also by regulatory bodies. So for this particular test, one was visual, just visual inspection of the packages, very simple, very straightforward, standardized under certain amount of light, so every single inspection is the same or as much as the previous one, as close as the previous one. And then the other ones were the bubble test and the peel test. So those give you an idea about if the bubble test fails, the sterility of that package is going to be compromised, because if the sterile barrier system is not protecting the device, we can assume that sterility has been lost. The peel pouch peel force is a little bit different because it's quantifiable, and we can determine how much or less force is required to open the package. Oh. So that was really interesting as well. And the evidence point towards direct correlation. So if you have packages exposed to non-ideal conditions, superheated seat condition within the context of this conversation and the research, the performance is going to be diminished by half in terms of how much force do you need. So if you peel it easier, is because it was exposed to this undesirable condition that may happen in hospitals today.
And it was quite dramatic, what the results you had from the tests.
About half.
That was eye-opening, really. Yeah.
Oh, that's interesting, though, because then that we can directly bring that over to as knowledge for the SPD professionals, basically saying, hey, guys, you may not want to read this entire paper, but I can tell you that if it's really easy for you to open your packages, there might be something wrong there, and it's time to look into it. Is that something that we're going to be trying to tell people in the future?
At the end of the day, I think it's important to publish, because once we publish in peer review journals like BINT, it's important. It's going to stay there, and people will benefit from it for the future generations.
Yeah.
But at the same time, not everyone will have the time or the willingness or the membership to access that particular paper. So to me personally, it's really important to simplify things, to try to reach to the sterile processing community, so we can give them the elevator speech. So guys, be careful. If you have wet packs, let's look into what is causing the wet packs. Let's not tweak into the jacket pressure parameters until we understand the root cause of those wet packs. So we can look into vacuum pressure, time to reach a vacuum, water temperature for the vacuum pump and whatnot. If everything fails, well, maybe you would like to explore something else, right? But ideally, be careful on how you're trying to address the problems you have today, such as wet packs, because you may be compromising the sterility of the devices you're so committed to deliver to the patients.
Right, causing a new problem tomorrow.
Yeah. Exactly.
Okay.
And you had shared studies that were done in a number of European countries, and I think you said 8 to 12% of pouches or packaging were subjected to superheated steam,
or
right?
cycles rather,
Cycles,
where at least evidence point towards that sort of range in very highly standardized vessels and systems and countries where sterility assurance it's very developed. So we do see that in different places as well. So it's not something that doesn't happen, because I think it's important to put things in context, right? All the research was done in a resistometer, a very tightly controlled laboratory equipment. So how does correlate into real world settings, right? So that's kind of my day-to-day question. So how does it behave, the laboratory test versus what our colleagues downstream in the sterile processing department are facing?
Is that something that you're working on now, trying to get a robust real-world sample size, getting to work with people?
I would love to. I think it would be important to be able to capture that information. I think because of the different nuances and the way we manage things in different parts of the world, the way we validate stem sterilizers in the U.S. is different compared to other markets,
factors,
right?
Yeah.
And in light of that, I think having U.S. data would be super important to try to expand that, because at the end of the day, we think about standard development, right? And I strongly believe that standard helps a lot to advance patient safety and as such. I truly believe on that. So if we identify that there's a problem, that can drive the conversation in the standard development community, and that can help us incorporate or update or improve the current standards for steam sterilization, for monitoring tools such as AAMI ST79 that eventually may or may not be recognized by the FDA. And if they are, they streamline the whole process for manufacturers that come into the regulatory process, so we can get clearance for products and processes as well.
Yep. Well, that's terrific. Well, I appreciate very much. We look forward to follow-up studies. Real-world studies are really ultimately what, as you mentioned, the healthcare facilities are going to look for to help justify change in behavior, change in practice. And the only other thing you mentioned at the end of your talk is you're happy to help anyone who wants to do some research.
And we spoke about briefly last time, Ralph, and I mean, I'm very grateful for AAMI, right? It helped me a lot with my research in the past and this last year as well, which helped me to complete my doctorate program as well. So I want to give back in a way. So I'm very willing to help people that want to try to submit applications to the grants for the upcoming year. So if they have questions on how to submit or how to narrow things down from the research questions, so from the research aims and whatnot, not everyone has that background in terms of research and whatnot, right? So not everyone has to be or want to be a researcher. But what I was referring to earlier, I mentioned you may have a good, valid question that you want to better understand, and you need money for that. you need time for that, you need support for that. So I will be happy to help them submit the grants. I don't want to be part of it. I don't have to be part of it, but maybe I can help them to submit successful applications so that they can pursue different research areas as well.
That's kind of you.
Yep. Very generous.
Well, gentlemen, thank you both for coming back, kind of digging into those questions that we left unanswered last time. And we're going to have so many links in the description of this video. We'll also link the paper now that it's published. So
it has to be submitted. It's going to be submitted hopefully by the end of the summer, and then committee review and editorial review and whatnot. So
I'll correct myself then.
By the end of the year, we're going to have the paper published, hopefully.
We'll put the news out then as well. But
Another opportunity.
Another opportunity.
Absolutely.
You can do another interview with Brian and me.
He loves this at this point. You're an old pro. Well, all right. Thanks again, guys.
Thank you.
Thank you, Brian.
Beautiful.